Hello everyone and welcome back to another educational and awareness session with Dr. Talha. Today I want to share with you the journey of another extremely fragile, as you can see, baby in our NICU. The little baby has admitted yesterday in our NICU. This baby is not just weak but also severely malnourished and dehydrated. Unlike many newborns who can feed at the breast or with a small tube like NG tube, like in yesterday's session I explained it that how we can feed through NG tube and OG tube to baby Zain. This baby is currently NPO. NPO means no per oral. It means in simple words nothing by mouth. And why is that? Because his stomach and lungs are underdeveloped. His swallowing reflex is very poor, very poor, which means he cannot safely suck or swallow. Along with this, he has significant neurological issues and is suffering from transient tachypnea, breathing too fast and struggling with each breath. For a baby like this, even a small drop of milk could go into the lungs, causing choking, aspiration, and even pneumonia, and at the end, unfortunately, can cause death. That is why feeding by mouth is not possible right now. In such condition, doctors rely on a specialized treatment called TPN, which means total parenteral nutrition. This is where all essential nutrients like glucose for energy, amino acid for growth, fats, vitamins, and minerals are delivered directly into the bloodstream through an IV line. It bypasses the stomach and intestine, giving the body the nutrition it needs to survive and recover when feeding by mouth is unsafe. But let me emphasize, the details of TPN are for medical professionals only. This is not something parents or families can manage at home. It requires strict monitoring, constant adjustment, and round-the-clock observation in an ICU setting. Now, along with medical treatment, we also give supportive care. As you can see in this video, I am performing oil massage and gentle physiotherapy for this baby. This may look simple, but it has powerful effect, even though it is small. The message: stimulate blood circulation, keeps the skin healthy and promotes bonding. Physiotherapy helps the muscles active and prevent stiffness, especially in babies who are too weak like this to move on their own. It also supports lungs expansion and improves oxygenation. These small but regular steps help fragile babies gain strength day by day. Another huge challenge we face is passing IV lines, which was the hardest thing in such babies. Their veins are extremely tiny, fragile, and often collapsed because of dehydration and malnutrition. Each attempt is delicate and time consuming. Sometimes it takes several careful tries, several careful pricks before a line is secured. But every line is a lifeline, because without it we cannot give fluids, medicines, or nutrition. Parents often don't realize the struggle behind this, but it is one of the hardest and most critical tasks in neonatal care. Like in this baby, I will talk about his mother. When we were passing IV line through this baby, so his mother stopped us. But after counseling, she realized that This is the most important step, and without this step, without passing IV line, without trying many times, uh, we cannot pass it too easily. Now, let's pause and talk about something even more important, the role of parents in such cases. When a baby is this sick, parents may feel helpless as though everything is only in the doctor's hands. But that is not true. Your role is always there. Your patience, your trust, your prayers, your willingness to stay strong alongside your baby. All of this is powerful. A calm and hopeful parents become a source of strength not only for the baby but also for the entire medical team. At the same time, I want to remind every expecting parent watching this video, while some conditions like underdeveloped organs or several neurological problems are beyond our control and may result from prematurity or genetics, many others can be prevented, like malnutrition, dehydration, and low birth weight are often preventable with awareness and care. So, what should parents keep in mind? The first thing you people keep in mind that ensure proper maternal nutrition during pregnancy. The baby's health begins with the mother's diet. So mother should focus on a healthy diet, on a proteinaceous diet, on a protein-rich diet. The second thing is never skip antenatal checkups. Early detection of complication can save life. When you think that you are expecting, go to a medical checkup, go for a medical checkup. The third thing is avoid harmful substances like tobacco, alcohol, and unnecessary medications. Don't take unnecessary medications. It can kill your baby even at your womb. Don't take alcohols. Don't take tobacco. It can kill your baby. It can cause death to your baby and your womb. Another thing, deliver in a hospital with a neonatal facilities, so if the complications occur, immediate care is available. The last thing is after birth, the most important thing is breastfeeding. It is the greatest natural protection for your child. I also talked about in yesterday's session, and I also explained the importance of breastfeeding in the session of baby Zain. He was also a malnourished, dehydrated, and low birth weight baby. And at the last, my advice to every parent is simple but powerful. Never ignore small signs. If your baby is feeding poorly, losing weight day by day, or showing unusual weakness, seek medical advice immediately. Many lives can be saved just by acting early. This little baby's case reminds us once again that while some battles are not in our hands, many others are. Medicine provides us with tools like IV nutrition, ventilators, and NICU care. But prevention and awareness lie in the hands of parents and families. Together with knowledge and care, we can reduce suffering and give every baby a stronger chance at survival. To all of you watching, thank you for supporting these awareness sessions. Your prayers, your compassion, and your willingness to learn truly matters for me and for all people. Every share, every kind word, every lesson taken from these videos can protect another baby somewhere in the world. And finally, for those who want to connect with me, if you have any question about neonatal health or want to share any medical problem related to newborn, I will leave my email in the comments below. Please feel free to reach out and I will try my best to guide you. Lastly, thank you everyone. Together with awareness, prevention, and care, we can give fragile babies like this not only treatment but also hope for a healthier tomorrow. Thank you.